My role is always disease management or health maintenance, and we have a very aggressive diabetic program. We're getting ready to launch an aggressive pain management program. 2013, our focus will be on COPD. My philosophy is it's just as important to educate the support staff on disease management as it is the medical staff, because the nurse or that frontline person is the one that actually interacts with a patient almost more than the provider. And so I provide a lot of education to my nursing staff and front office staff, as well as the medical staff. I have their input in writing protocols. We review processes with them, we interact with them, so it is a big team, is how we work. We are actually working towards a patient-centered medical home, and hopefully in the next couple of years we'll be applying for NCQA certification. Realistically, we probably could be applying right now. I don't feel comfortable with that simply because I'm a perfectionist and I want to make sure we're doing it right 95% of the time, not 75% of the time. So as we move forward with the implementation of our electronic health record, and we're almost there where we're paperless, we will see more PCMH or patient-centered medical home outcomes, or better, stronger outcomes. I honestly believe, and I get emotional about it, that here in Ellsworth, for example, our breast cancer awareness started 3 years ago with our first breast cancer awareness program that ECMC has seen. Since then, we've grown the program 300%. In the first year alone, we diagnosed 14 women with breast cancer, 2 of them at stage 3, and that was in the first 2 months of launching the program. So it's actually making a difference in people's lives, whether it's through prevention or awareness. It is having an impact, and right now we're launching a huge program on a healthy community. So we have a community consortia. We meet with local community leaders and religious groups, so that we are looking at ways of creating a master plan to grow Ellsworth strong, and that's very exciting. We also had a program that we launched in February and April, huge program where we went out to the middle school, and for 90 days we monitored children's physical activity and their diet. And we started with a food log, we did blood sugar, blood pressure, BMI, and went back 2 months later after they had been on the program. Sadly and alarmingly, 44% of the kids that we tested had extremely high cholesterol, and 3 kids were diagnosed with diabetes. So we know there's a problem out there, but we've got to do a better job of getting out there and having a positive impact. Through that program, though, the schools now have stepped up and they're looking at their menus, they're looking how they can be involved. So it's creating awareness and partnerships at the same time.